Now I'd like to introduce our speaker. Madeleine Castellanos, MD, is a board-certified psychiatrist specializing in sex therapy and the improvement of the sex lives of couples and individuals. She is committed to helping others learn about their own sexuality and how to achieve physical and emotional balance in their sex lives. As a physician and sex therapist, she uses her passion for positive thinking, exercise, and nutrition to help guide her clients to a position of balance and happiness. Dr. Castellanos?
Hi, thank you very much, Ivis. It's a pleasure to be here. As Ivis said, I am a psychiatrist. I'm an MD who has been specializing in sex therapy for quite some time, over 15 years. And today we're going to be talking about your sexuality after cancer, which again is a topic that I'm quite passionate about, and sexuality in general, but certainly cancer has a big impact on that. So you can find me under the sexmd.com and in all the usual places as well. And I have a book called Wanting to Want, in which, although I don't describe specifically cancer, I do talk about some of the psychological issues that affect sexuality and desire in couples, and part of that does have to do with some of what we're going to discuss today. So I just put that up there for people, although it's not specifically about cancer. It does discuss a lot of the psychological aspects of sexuality and what might interrupt those for a person. So let's get started. Okay, so today we are going to focus on a few things. First, we're going to talk about the importance of sex and sexuality in health and in life. We're also going to talk about problems with sexual issues resulting from cancer and also from cancer treatment, because they can be a little different but certainly impactful. I'm going to talk about ways to address sexual issues after a diagnosis of cancer and after treatment for cancer as well. So let's start off with the first of these, the importance of sex and sexuality in health and in life. Now first, I'd like to do a poll question of all you people out there who want to let us know in what way has cancer impacted your sex life the most. So first, it could be intimacy and closeness with my partner. It could be the physical feeling of sex. It could be change in my desire for sex, or my body's response to sexual touch and stimulation. So let me see if those poll questions are coming. And give people about a minute. In what way has cancer impacted your sex life the most? A, intimacy and closeness with my partner. B, physical feeling of sex. C, change in my desire for sex. Or D, my body's response to sexual touch and stimulation. See if I can see the poll results. Okay. I would love to see the poll results, and I cannot see the poll results. Let's see if I can.
Hi, Dr. Castellano and team. This is Ivis. Okay, so I will read it out to you. It's if cancer has affected your sex life, and what way has it impacted your sex life the most? The highest one was change in my desire for sex. That was 6%. Then intimacy and closeness with my partner, which is 30%. And the physical feeling of sex was 10%. So once again, the highest rated was change in my desire for sex.
And then what about my body's response to sexual touch and stimulation? Anything?
Not one, 0%.
Not one. Wow, okay. All right, great. So most people would say change in my desire for sex. The next then was intimacy and closeness with my partner. And then the smaller one was their actual physical feeling of sex. All right, great. So we can see that, and libido happens to be a very big problem overall for most people anyway. And so having difficulty with issues related to cancer and cancer treatment just further impacts an already very difficult issue for women everywhere. But a second behind that would be intimacy and closeness, which we're going to talk about because that's very, very destructive to a relationship, obviously. All right, so what do we mean by the terms sex and sexuality? I want to clarify this because I want to make sure we're all on the same page. When I talk about sex, I'm really talking about the behavior of sex. So I'm talking about something that you do, right? The actual act of sex. And even then, under the definition of sex as an act, there can be many, many different interpretations of that. Now, I, as a sex therapist, have a very wide range of what I consider to fall under the category of sex. And that's because it's just, it really encompasses so much of what we do with our partner. And so kissing, getting aroused, stimulating, touching and caressing, oral sex, manual stimulation, anything that gives you pleasure over your body, and then, of course, penetrative sex, I think falls under the definition of sex. Now, that could be a very, very helpful way of looking at it because it also changes how we think about sex. If we only think about sex as penetration, then it's almost like we cast a negative shadow on all other activities that come before that or after that, right? Because you can have any mix and match of behaviors and that be part of your sexual repertoire. So I think it's very important to talk about sex as behavior and understand that the more you add to your sexual repertoire, then the more you have to choose from. And so that gives people more options, which I think is what we're talking about here is how can we increase our options, right? And not have it be so limited. Sexuality, on the other hand, is a part of who you are. Sexuality is something that nobody can ever take away from you because it really goes down to the depth of just everything that you are. And so when I talk about that, I think it encompasses the physical in the way that you develop, your particular sensitivity to hormones and hormone receptors, your body style, how sensitive you might be behind the knees or across your neck, or sometimes breasts are not as sensitive as others, or sometimes your waistline. So all of those things have to do with physical. The psychological aspect of sexuality, so how you think about yourself, what is sexiness to you, what sort of things do you interpret as being sexy and positive, as opposed to things that turn you off or you don't like so much. So that's the psychological part of your sexuality. Also, things that have been taught to you from your family, from your teachers, your friends, as to what's considered okay, what's considered dirty, what's considered bad, what's considered sexy. All of those things play into your psychological sexuality, that aspect of yourself, that dimension of yourself. So next, there's the emotional, which is very intimately tied to the psychological, because the emotional is the feelings that you have in response to something that's happening or thoughts that you have inside of yourself. So if you interpret something as positive, then usually to have that or to be experiencing that brings you a feeling of happiness, of joy, of delight, of contentment, of satisfaction. And the opposite is true. If you interpret something as negative, then it might bring feelings of guilt or sadness or anger or disgust. And so therefore the emotional makes up part of your sexuality as well. And then lastly, I'm going to add spiritual because something wonderful happens in our experience of sexuality is that many times it takes us outside of ourselves. And I'm not going to get too caught up in the neurophysiology of this, but it seems to be more of a right brain phenomenon. And the right brain is concerned with our physical place in the world and our connection to other things and our relationship to other things. And so when we have sex and we get very aroused, especially when you experience orgasm, parts of your brain really shut down and the right brain sort of predominates in that experience that can feel transcendent. And so part of that is how we experience pleasure. We're certainly created with the ability to experience pleasure. And we know that sex is pleasurable because that's the way that we have reinforcement of it. And so it is part of our design. And so if your spiritual beliefs let you understand that that is part of our natural design, and you can see how the spiritual aspect of sexuality plays in as well. So these are things that people cannot take away from you unless you allow them to do so or you change your mindset about something, because it is who you are at the very core. So let's talk about sex and sexuality and how they affect each other. And I think you see in the slides what I was just telling you, how that might be the case. So first of all, there's many, many benefits of sex. We have the physical health aspect of sex, and that is things like better dealing with stress, lower blood pressure, better control of hormones, better blood flow through your whole body, better cardiovascular functioning, even protection against dementia. Definitely have more balanced neurotransmitters, so anxiety and depression are better. And so you could see how the act of sex, the behavior, the part that we talked about, which is the physical act, can then also affect your sexuality in the physical dimension of it, because as you have more sex, then it reinforces that in your body, and so therefore benefits your physical health that way, and the sexuality dimension, the physical aspect of your sexuality. Psychological well-being, so you feel happier, you feel less stress, you feel closer to your partner. Those things also help you in the connection between the sexual behavior and then your feeling of your own sexuality, because there is that positive reinforcement. Connection with your partner, obviously. This was a big one for some of you in the poll. Pleasure. And I've discussed how sex is designed to have pleasure, and that's what actually reinforces sexual behavior. And that's not just true for us, that's true for the animal kingdom. So there's a design in that. Pleasure plays a big part of that. Feeling powerful. So part of having a sexual experience is you get this boost of testosterone, and it does actually help people feel powerful. They feel their blood flowing, they feel their muscles working, and they feel that they have the capacity to also contribute to arousal of another person, which is magnificent in and of itself. Happiness, for all the reasons that we've discussed. Vitality, also sort of connected to feeling powerful, but it also is part of just the way that your body is meant to respond to sex. And feeling alive. You know, this is part of why we're here, is to experience things like this, like sex, to have this connection to ourselves and then with another person. So if you have positive experiences then in sex, then what it does is it enhances your sense of your own sexuality. If you tend to have negative experiences in sex, or start to think about things very negatively in sex, which will color your experiences of sex actually, then it starts to negatively affect your sexuality and may cause you to do things like avoid and have more negative feelings attached to that. So sex and sexuality affect each other, definitely. It's very important to understand that. So now let's focus on the second objective, which is problems with sexual issues resulting from cancer and cancer treatment. And we all of us that have gone through either having a diagnosis of cancer and or having that and treatment know that this is going to impact our sex life. Let's do, I think there's gotta put a poll in here. Okay, well, let's just talk about this quickly. Cancer impacts sex in certain ways. First, physical, which is the most obvious, because one of the main treatments is surgery. Surgery, of course, will be something that leaves scars, changes the shape of your body, changes the sensations that happen in your body, can leave a woman without her ovaries that do not allow her then to have the same hormone levels that she had before. So surgery is a very drastic process, very necessary, but has definite physical impact on sex and then therefore also our sexuality. Radiation, which is very common for cancer treatment, can cause a lot of local damage to tissues, and the body sometimes recovers very well and then sometimes recovers with scar tissue. So there will be times when people have scar tissue that is not as elastic, and so therefore there's more irritation. If they get radiation down in the lower pelvis, they could have difficulty with other organs as a byproduct of having radiation in that area. So radiation can cause definitely a physical impact on sex. Chemotherapy, which tends to not only make us physically sick, but if we have chemotherapy that blocks estrogen receptors, or if you have SERM, then what you're going to end up with is not just the feeling weak, feeling all of those things that in the moment affect you from chemotherapy, but if you go long-term into using things like SERMs, then you're going to have sorry, then you're going to have longer withdrawal of what we call trophic factors. So withdrawal of hormones that then end up taking away the support for those tissues. So vaginal tissues, the vaginal tissue, which is very, very sensitive to estrogen and changes in estrogen, will become much more frail, much more weak, and the tissues can get tighter. There can be tightening of the vagina. All of this happens. Surgery has its part, radiation has its part, chemotherapy, and then, as I was talking about before with the SERMs, the hormone suppression has its part. So obviously, the GYN cancers, breast cancer, ovarian cancer, uterine cancer, the treatments that are provided can have very, very significant effects for women. So her body image changes as her body changes. She may have scars that she didn't have before. She may have reconstruction that is different, feels different, looks different than how she was previously. She could have had a total hysterectomy and oophorectomy, which then can shorten the distance of her vagina. Then she can have hormone suppression, which can actually shrink the vagina even further and cause vulvovaginal atrophy, which is when the vagina gets very tight, when it gets friable, where it's very easily irritated. And sometimes she feels this even when she's not having sex. She could just be sitting there and have this, and if she has significant vulvovaginal atrophy from these factors, and just feel uncomfortable, itching. Again, as I talked about, that negative reinforcement cycle then starts to happen as she starts to have negative thoughts about her own sexuality, creating negative feelings, perhaps some avoidance behavior, and then now we're not giving the body more positive reinforcement that it needs to continue to have sex. So there's psychological and emotional. Of course, I already talked about how the physical and the psychological and emotional are related. So body image is huge. Sometimes it's difficult for a woman to accept how she feels after she's had reconstructive surgery or mastectomy and she's using prosthesis. Sometimes the woman is fine with it, but her partner is not fine with it. So there's a lot of things to consider when it comes to body image, because then she may actually start to feel worse if her partner starts to avoid or have hesitancy. And you're going to see when I talk about communication why that becomes a very big deal. So body image, again, comes from her own thoughts about it, but then reinforced by how her partner also responds to it. Connection to her own body. This to me is one of the most important things, because through the whole process of being diagnosed with cancer and having cancer treatment, in a sense, you have to detach a little bit from your body in order to go through that whole process. And it's very difficult because sexuality is just really at the core of who we are. And if we disconnect from that, we really lose a sense of that for ourselves. And connection to the body, once you've lost sensation in certain parts, even something as simple as a surgical scar from a total hysterectomy where you feel numbness over the top of your belly that you never felt before, from all the way to a complete reconstructive with an abdominal flap, which now you have surgical sites on 2 areas of the body. Very, very large impact on how you feel, and then therefore your connection to your own body, because your body's not giving you the same signals that it was before. So this is something to put conscious attention to, and it's one of the things that I do discuss in my book about being disconnected from your own body and how that does affect your sexuality. But of course, with cancer and cancer treatment, it's much, much more pronounced. Sense of femininity. So this can be challenged when someone has a GYN cancer and treatment, because so much of how we feel feminine has to do with how we've grown up and our sense of our shape, its responsiveness, and our hormones and our cycles. And when that gets abruptly taken away, then it really does require a mind shift in thinking, okay, what really makes me who I am? What really makes me feminine? Is it just my breasts? Is it just my ability to be able to have kids, right? Is that it? Is my menstrual cycle, is that the only thing that defines me as a woman? And sometimes some women have I won't say no trouble, but very little trouble making that shift into redefining themselves into this is who I am, this is what makes me a woman, and this is what brings me pleasure. Whereas other women have a very difficult time with this and perhaps need more support around that area. And of course, finally, sexuality, which we're talking about, which is all of these different aspects of ourselves that reinforce each other like a web. I really want to point out it's not a linear relationship. It is this web-like structure of everything affecting everything else, and that's why it's so important. And our relationships. So we know, obviously, that cancer impacts our relationships greatly, and it's very, very important to really, really address this. Anxiety is one of the biggest issues that keeps us away from our partners. We're not really sure how they're going to respond. We worry that they're going to be unhappy. We worry that we're not going to respond the same way. That anxiety then starts to create this rift between a woman and her partner. And that needs to be addressed right away, because the anxiety, which, as you know, is part of the fight or flight response, right, the stress response, that also creates a metabolic environment in your body that actually works against you healing. So anxiety is one of those things to really attend to as soon as it pops up, because being under lots of stress already from cancer and cancer treatment can impact significantly how you heal, but then continued anxiety also is going to continue to affect that. Distance and avoidance. So if we have anxiety, if we're not really sure how to talk about things, then it just sometimes becomes easier to avoid, that conflict. And that can be a slippery slope, because the more we avoid, the more anxiety builds up, and then the more we tend to avoid. And, anxiety also physically, it's not just an emotion. There are physiological aspects to anxiety, which is muscle tension. You don't sense as much from your nerves. Your blood flow gets cut off. And so in that aspect, the distance and avoidance cause you to then avoid having the sexual contact, don't have the same blood flow that you did before, and the same sensations coming through your nerves up to your brain, reinforcing those pathways, and then you have more anxiety on top of that, just compounding the situation, creating a very negative situation physically. So intimacy. Now, intimacy can mean a lot of things for a lot of people. I like the definition of, when I explain intimacy to couples, I tell them, to me, intimacy is when you open up a part of yourself and you just share that with your partner, just because you want to share that with them. And it's really a gift, and you really do it expecting nothing in return. Now, most people will say, well, intimacy is I give and then you give back. And certainly that's the hope. But I think intimacy is just sharing something with your partner, something that you want them to know. Closeness, those things are part of intimacy. I consider intimacy just to be that sharing aspect. Sadness. So cancer and cancer treatment obviously create a whole different list of priorities for one in one's life. And partners, it's very common for not just a woman, but for a partner to be sad and mourn the changes that have happened, the worries that they now have to think about, the, that for some people life can't be as carefree as it was before. They have things to worry about, and the sadness that it has changed things. And it's okay, I think, to acknowledge that. It's when you don't acknowledge the sadness that then it becomes problematic. Because then what's happening is it's almost like you're avoiding a reality, right? It's like avoiding the elephant in the room. And it's important to say, okay, you know what? I recognize that this is happening to us and it makes me sad. How does it make you sad? And how can we deal with this? Now, when people make decisions about treatments for cancer, those treatments are based on, hey, I want to live. Like, what do I need to do to increase my chances for survival? And I want to point this out because usually those decisions don't consider what's going to happen to my sex life later and my own sexuality. But there's a reason for that, because, when you're in survival mode, that's what you have to do. Now, I think right now there are more physicians out there and more providers that are starting to discuss sexuality and the impacts it's going to have with their patients. But ultimately, the focus is still on survival, and obviously that's the way it should be. But I want you to understand that, because some people will feel afterwards, they'll feel guilty, they'll feel angry, they'll feel upset with their providers, and they'll say, well, how come we never discussed this? And I think you need to understand that all treatment, is focused on surviving. And really that's the main goal. So if you keep that in mind and understand that and speak with your providers about that, if you have the opportunity to do that before you have treatment, that's fantastic. If it's afterwards, then understand that those were the decisions that you guys were making together. I think that's very important to understand. Okay, so let's talk about obstacles to focusing on sex and sexuality. So here is a poll question, which you guys will help me out with. Now, I know that the poll questions, I have long answers here, so the answers might be a little truncated, but I'm going to read them to you. So in regards to communication about sex from your doctor or provider, which is true? A, my doctor explained with detail what the effects on my sex life might be and gave me an opportunity to ask questions. B, my doctor mentioned that there may be some side effects and mentioned what options I may have. C, my doctor said that my sex life would be affected but did not get specific. Or D, my doctor never mentioned the effects that cancer or cancer treatments would have on my sex life. I'm so interested to hear how this question comes out. So as you guys are voting, I'm going to just read them one more time. A, my doctor explained with detail what the effects on my sex life would be and gave me an opportunity to ask questions. B, my doctor mentioned that there may be some side effects and mentioned what options I may have. C, my doctor said that my sex life would be affected but did not get specific. And D, my doctor never mentioned the effects that the cancer or cancer treatments would have on my sex life. So I'm waiting to see what the results are.
Hello?
Yes?
Okay, I wanted to give you the results.
Okay, great.
Okay, so now it's 75% of the doctors never mentioned the effects of cancer. That was the one that had the highest.
Wow, okay. And do you
And the
have,
other two, B and C, were 13%, and A was 0%.
oh my goodness, okay. So, so here we see that obviously the answer D, my doctor never mentioned the effects that cancer or cancer treatments would have on my sex life. 75% of you said that that was the true for you. And between B and C, which is that there was some mention about it and some options, some talk about what you might have, but they may or may not have been specific, we're split about 13%. And unfortunately, nobody that's attending the conference today said that their doctor explained with detail the effects on the sex life, and that gave them an opportunity to ask questions. And that's part of why we're doing this, because as I mentioned before, the treatment decisions are based on survival, but it's very important to have these conversations because sexuality is such a huge part of who we are and contributes so much to our own physical health. So let's talk about some of the obstacles. You know, obstacles exist on both sides. Obstacle exists for patients, obstacle exists for providers, and I'm not here to judge anyone, but simply to point these out so that we can have better communications moving forward. And for patients, you know, feeling guilty is a very big obstacle. You know, they think, wow, here I have this serious disease, life-threatening, and I'm thinking like, I'm talking about sex, like I shouldn't be doing that. You know, it's not really that important compared to what's happening to me. And so that can be an obstacle for patients just to ask the question and start the conversation. Fear of disappointment or being pessimistic. So some people may already have a very negative view of what's going to happen to their sexuality, and they are afraid or worried or maybe even convince themselves that they're not going to get any really positive responses or positive suggestions, and so therefore they don't even ask the question because they've sort of, it's a confirmation bias thing. They've already figured it out in their head, and so they're not even going to ask. You know, some people don't want to appear greedy. This is similar to the first one of feeling guilty. Is they think, you know, gosh, I've already gotten this far. I survived. You know, perhaps I survived the surgery, or I was diagnosed early, or you know, they're telling me my chances are good, and I just don't really want to push it. Like I don't want, like I don't deserve more. And so I think that really does hold people back. That doesn't mean that you can't have the conversation. Conversation is important to have, and then you can weigh all the information and decide what the next step for you should be. And oftentimes, you know, people don't want to be a bad patient. You know, I've spoken to people who say, yeah, you know, I didn't have a discussion about it. I'm starting tomorrow with this treatment, and I'm just going to do it because it's all set up, and I'm not going to ask the question because, you know, I don't want my doctor to be upset. I've already gone through all this stuff in there. And I want people to understand that physicians are not going to be upset if you delay things or talk to them about it, because this is your life. This is an aspect of your life, your relationship, that is extremely important. And if you do find a physician that's upset with you or punishes you, or then there are many, many, many physicians who will not act that way. And I hope that there are some providers on the line today, and if you are, it's obviously because you're interested in learning more about how to talk to your patients. So we're going to talk about obstacles for providers in a moment, but understand that sometimes there is this pressure of like, oh, I have to be a good patient, and so therefore the conversation is never even approached because of that. So obstacles for providers. You know, sometimes providers feel that maybe it's not their place to talk about it. So the oncologist might say, well, it's not my place. It's really the gynecologist's place to talk about it. Or, you know, maybe it's the general practitioner or the therapist. And I think that that's a big misconception, because they at least should be able to address it so that the conversation starts. I think if they feel, well, if I don't ask, then the patient's not going to tell me, and then that's better. And maybe that way nothing's really happening, and I can just avoid the thought that this may be causing something very negative. And again, because treatment is focused on survival, there's this idea that that is primary, the most important factor, and it is. However, it does not mean that other factors aren't important and shouldn't be addressed as well. Part of feeling like it's not their place is many providers feel that they don't have the resources. Maybe they're afraid that they're going to be asked a question that they don't know the answer to. And I've given talks to providers, physicians, nurses, therapists about how to approach sexuality with your patients, and I tell them, you don't have to have all the answers. You really don't. In fact, if a patient asks you a question and you don't know the answer, then the right answer is, I don't know the answer to that question, but I can find out. And I guarantee you that if that provider takes that stance and does ask the question and find out the answer to the question, then the next time, because you're not going to be the only one asking the provider this question about your sex and sexuality, and they can start to find the resources in their community, in their network, to add to their toolbox. So they can say, I have somebody that you can come speak to, or I have someone that you could talk to, or here's a book about, cancer options, sex options after cancer, or here's a group that I can refer you to. And so once they don't have to have all the resources right at once, but they start to fill their toolkit with all of these resources that then they can provide to their patients. And it's not always about sitting down and having an hour-long talk either. Sometimes they feel it's too complicated for their expertise, and sexuality is a very specialized area, and it's okay as long as they know where then to send their patients for those resources, so they build a community network where all of these things get spoken about. Okay, so now let's focus on ways to address sexual issues after cancer diagnosis and treatment. So our last poll question here is, how important do you think your sexuality is to your health and your happiness? A, not important at all. I don't believe that sex has any effect on my life. B, mildly important. It may have some small effect, but no really significant impact. C, significant importance. I think that it has an effect and it adds to my life. Or D, very important. I think that its effects are undeniably connected to who I am and that it's a vital part of my health and my happiness. Okay, I'm going to just read these one more time, so they might be a little truncated as you guys are answering. How important do you think your sexuality is to your health and happiness? A, not important at all. B, mildly important, small effect, but not a significant impact. C, significantly important. I think it has an effect and it adds to my life. Or D, very important. I think that its effects are undeniably connected to who I am and that it's a vital part of my health and happiness.
Okay, so the results are in. A is 0%, B is 0%, and significantly important, it adds to my life, is the highest, 67%, and very important is a vital part of my health and happiness, is at 33%.
Wow, okay, great. So this, obviously I think you all are here because it does have some importance, so I kind of did expect that the answers would be more on the significantly important and very important, because if you didn't think that it wasn't important, you probably wouldn't be attending this webinar right now. So for all of the reasons that I've already mentioned, I do believe that it is very important. And part of survival, right? Part of healing and recovery and staying in remission is changing our metabolic environment inside. I do believe that there's usually when there's cancer, there is some combination of perhaps a genetic predisposition, perhaps an environmental exposure of something, but then also what's happening in our bodies, right? Which is a combination of nutrition and thoughts and feelings, emotions, and that all get translated into a physiological response. that on a cellular level has dramatic effects. And so when we add to our happiness, when we add to our balance with sexuality, then that also contributes to our physical health. So I'm very happy to hear you guys say that. Okay, so I've sort of said this already, but I will mention it again. Benefits to addressing sex and sexuality. Okay, I'm going to go from the basic to the more individual. And what I mean by that is everybody has to decide with this information that I'm going to give you now where it seems right for them. Because not all of it will be right for everybody. And some people feel that they really do not want to take any risks whatsoever. Some people just want very, very minimal things, where other people feel comfortable enough, they know down deep in their gut that it's okay for them to try something that another woman might not try. And so the information that I'm going to give you here is more basic, but you all have to individualize it for yourselves. So first, as I started mentioning before, is communication. Communication is the key that opens the doors. Without it, it just becomes almost an impassable gap. It really is. Communication with your partner is the first most vital thing. Obviously there's a lot of reactions that come with a diagnosis of cancer, and the treatment that comes with cancer has its own challenges. So communicating about that and about all of the feelings that come up with that, I think, are vital. Sometimes couples find that they haven't really had good communication until they get something as challenging as a diagnosis of cancer, and then it becomes really that much more difficult. But I urge you to all stand up to the challenge. If you have difficulty communicating with your partner, I would really encourage you to find a therapist that would help you. It doesn't have to be a sex therapist, it could be just a couples therapist, just for the communication aspect of it, because it is so important. Communication is not something that you just do one time. It's really like a phone line, right? It's the difference between having two tin cans with a string attached to them and saying, "What? I can't hear you," to having a direct, very, very powerful landline that has no static, and you can communicate anything you want, anytime you want. So you really want to have open lines of communication so that you can talk about all of these aspects in all of their different dimensions. So I just mentioned before, communicating with providers. Sometimes I'll encourage women to write down questions ahead of time, because when you're going to see your providers, they are limited by time constraints many times, unfortunately, and they don't want to be limited by time constraints either, but they are. That's the reality of it. So if you have questions ahead of time that you can jot down before you go to your visits, that really helps you address some of them. And if you can't get to them all, then say, "I would like to really have these answered. Can I email you these questions? Or how can we get these answered?" Because you want to start having that open dialogue with them. And I guarantee you that if you find a provider that is not comfortable when you're talking to them, just having that conversation with them will make them more comfortable for the next person, because they'll see that it's not something to be avoided and it does have importance for women. And they start to practice. They start to practice what it's like communicating. And you can see the difference between the providers who are very, very comfortable in talking to women about sexuality and answering questions and referring them to the appropriate resources. Friends and family. Now, when I mention here friends and family, I'm not talking about discussing your sexuality per se with friends and family, but what I am talking about is just discussing your feelings in general. And some people do this very well, and some people not so much, and there's more avoidance. And the reason why I put this in here is because, as I mentioned before, for healing, part of how we are as women is we really tend to what they call tend and befriend. When we get very stressed, we want our social network there. That is what gives us strength, comfort, and security. And so communicating to your friends and to your family as to what you might need during those times is extremely important. So again, not specifically about sex and sexuality, that's not what I'm saying is, but just to let them know, what do you need? The women that say, "I can do it all on my own and I don't need anybody's help," they they put themselves on an island, and as women, that's really goes against our physiology and our hormones and how our brains work. And lastly, supporting each other. I know that groups are so vital for people, and finding a good group that you can have a good discussion on everything having to do with your cancer and cancer treatments, and you find a group that you really mesh with, that builds a network that is so strong that sometimes even surpasses the bonds of family. So I really encourage you all to go out there and look for groups, whether it's a friend group, whether it's a formal therapy group or a support group. Do find that resource. Sorry. Okay, taking steps. I'm going to have to go a little quicker because I'm going to run out of time here. Sense of sexuality and body image. You know, you want to focus on the positive. Your brain is learning all the time. And when you think about things in a negative way, what you're doing is you're reinforcing your brain's way of thinking about things in a negative way. So it's very important that you address the issues having to do with your sense of sexuality and body image, because those are going to be like either rose-colored glasses or tinted glasses that then color your view of how you see your situation. I tell women, I tell couples, I tell everyone, focus on pleasure rather than on what's lost. Now, I'm not saying be like an ostrich with your head in the sand and completely in denial of what's been lost and what's changed. Of course not. That has to be stated, that has to be acknowledged. But if that becomes then your focus from that point forward, then you're not going to really be able to move forward. The way you move forward with sexuality, with pleasure, really with anything else in your life, is you find what's working and you find a way to enhance that. You find a way to build on that. You find a way to increase that in your life. And then what happens is that that grows and grows and grows, and then there is less room for negativity. There is less room for those things that don't work. And that's okay. That's the natural order of how we change the world, how we are co-creators in the world. Gratitude exercises. You know, when I talk about gratitude exercises, I don't want to sound all new agey because I am an MD. I want to point out that there's actual physiological changes that happen in your brain when you do gratitude exercises. You know, your brain is plastic, and what that means is it's changing all the time. And when a person does gratitude exercises on a regular basis, they find that it forces them to think about what's the most positive thing that's happening right now. And this is very important because in terms of survival, our brain is designed to always look at what's negative. And it scans the environment to try to find all the problems that are out there so it can solve it ahead of time so that it can relax. Well, as you can imagine, in our current day and age, there's an unlimited number of problems, so we could never possibly solve them all. And sometimes that negative focus of scanning and looking at the environment gets carried away, and then we become, in a sense, negative in our viewpoint, in our overall viewpoint. Well, gratitude really works in the opposite direction and really teaches your brain to, hey, let's strengthen our ability to focus on what's positive. And that has tremendous effects, not just for your sexuality, but for your happiness and pleasure and connection with people as well. Now, sensual exercises. I talk a little bit about this in my book because I think it's so important, especially if you have disconnection from your own body and disconnection from your partner. But sensual exercises are just time devoted to providing stimulation through all of your five senses. It could be neutrally focused, and when I say neutrally focused, I mean not on sex, or it could be sexually focused. So an example is where your five senses are, first of all, sight, hearing, smell, taste, and touch. So you could be listening to a wonderful piece of music that really moves you. You could be tasting an amazing, new recipe for sauteed vegetables. You could have the most fantastic hand massage. You could be looking at this amazing painting. Or the happiness in someone's face. So all of these exercises where you are mindfully paying attention to the sensation actually build your ability to focus on those sensations. So obviously you could do this in a neutral way, just focused on pleasure, or you can also do this in a sexual way and do a little bit of experimenting and, I like to call sexual research, right, with your partner. So options for discomfort in sex. I'm going to go through these rather quickly. For body image, people can get creative. There's certain clothing that you would like to use when you're having sexual activity. That's completely fine. Some people like to use pillows arranged in a certain way for their comfort. Sometimes they like to hide behind pillows, or sometimes they like to prop themselves up with pillows. You really have to decide, again, this is going from basic to individual, in what way can this enhance your experience of sex? Lighting is another big one. Some people will find that they want to change the lighting to something that feels more favorable to them. And again, I think you need to understand what works for you and then enhance that as much as possible, rather than trying to recreate something that was in the past. Start with where you are now and then move forward. So let's talk about non-hormonal options for discomfort in sex. Replens is probably the best known for vaginal moisture. And this is not necessarily for sex. I want to point out the difference between moisture, vaginal moisture, and lubrication during sex. Now, with a lot of OBGYN cancers, you can get changes in both, although sometimes women only have change in one. But Replens is for day-to-day moisture. Without day-to-day moisture, it's going to be difficult to have a good sensation in sex with penetration because the vagina does become much more irritable. So Replens is used to help plump up the tissues inside of the vagina, and that helps with the day-to-day moisture. Silicone lubricant is a wonderful option for women when they've had hormone suppression, or they've had their ovaries taken out and they have been thrust into a surgical menopause. That's usually much more drastic than if a woman goes naturally through menopause. The silicone lubricant is especially nice because it really does create a slick surface that doesn't dry up or get tacky like some water-based lubes do. And you can combine silicone lubricant with water-based lubricants as well. So I think that's important to know. But I always tell women, if you don't have estrogen support, you do have vulvovaginal atrophy, you should start off with a silicone lubricant, and if you want to add on some water-based onto that, that's fine. And I would say that I get a lot of questions about coconut oil. I think coconut oil is perfectly fine. I would not recommend other oils at this time. Coconut oil is nice and thin enough. I wouldn't use more than you would use of a silicone lube, for example. I would make sure that you get a very clean type of coconut oil, so cold pressed virgin coconut oil. Make sure it's not like a processed or refined. And some women really like this. Some women find that they can use this in place of a silicone lube. So all of these can be mixed and matched, but just be careful because silicone lubricant can stain sheets. So you may want to have a little towel or a little sheet that's specific for just your sexual activity, because any oil or silicone can stain sheets. And dilator therapy. So when women have vulvovaginal atrophy and then they want to get back to sex, if they've had radiation, if they've had surgery, and if they've had hormone suppression, this can significantly affect the size of the vaginal canal. So dilator therapy is when you take dilators starting off with a very small size, and then you basically insert them in the vagina and allow those to stretch the tissues. And then little by little, as you become more comfortable and those tissues stretch, you can use progressively larger sizes of dilators. It's done with lubricant, and oftentimes psychotherapy or sex therapy in conjunction with doing dilator therapy can be very helpful too, because so many feelings, thoughts can come up while you're doing dilator therapy. So I actually recommend that dilator therapy be done at the same time with therapy. Yeah.
Madeleine, I'm sorry, we have a 5-minute warning.
Okay. All right, we're almost done. I'm going to talk quickly about hormonal options for discomfort in sex. Now, I know hormones are very controversial when it comes to cancer and cancer treatment. And I would say that first of all, what I'm going to talk about here are simply local hormones. I don't think that anyone would ever recommend systemic hormones at this point in time for someone who's had a cancer that has responded to estrogen. And that's obviously because it could cause further growth of that tissue. But if a woman wants to use hormones locally, she has a couple of options. She can use tabs or suppositories that are inserted into the vagina. She can use estradiol rings. So estradiol is the main estrogen. She can use estradiol rings, gels, or creams. And then just recently, there was also an article that came out that's saying that even though DHEA systemically is not recommended for women with breast cancer, that suppositories intravaginally of DHEA may be recommended for women with breast cancer. Again, I've had many discussions with oncologists about this, about local hormones that would help support the tissues in that area. Nobody can quantify the risk for you because there aren't research studies really done with this, and I don't think that anyone's going to rush out to try a research study that is so controversial because they're afraid of adverse effects. But those are options for you to discuss with them, and then each person decide for themselves, okay, where do I fall in the risk category? What do I want? What are my priorities? Now, I just want to throw in here options for hot flashes, even though it's not about sex in particular, because again, I want to have these conversations with your providers. Black cohosh is an option that can be used that's non-hormonal. Flaxseed can be used, not flax oil, because it gets rancid very, very quickly, and I would not buy products with flaxseed in them. What I recommend people do is they buy flaxseed, have like a little coffee grinder, you grind it up, and then you use about 1 to 3 tablespoons immediately after you grind it up. Just, add it over your salad or in your sauces, and then eat it that way, fresh. And then also paroxetine or venlafaxine have been used for hot flashes. Not my favorite options. I prefer not to use things that mess with neurotransmitters, but some women find it very helpful. And again, it's about talking about this with your healthcare provider. And being active matters. I mentioned how regular sexual activity is very important because the body works on a use it or lose it principle, and therefore regular sexual activity, masturbation, and vibrator therapy can be extremely important for maintaining your sexual functioning, because each of these brings blood flow to the area and they keep your nerves firing, which keeps the signals coming back up to your brain. So being active really does matter. It's about choosing what activities are pleasurable for you and then building on those. So takeaways really quick. Sexuality is a part of who you are, and it can never really be lost. It can be affected, but it is part of who you are as a person. And I want you to remember that. Communication and connection with yourself and the people around you is absolutely vital. Please do not try to be on an island alone by yourself, and it's really the only way to move forward. And focus on what you have, what works for you in order to enhance your experience rather than focusing on what's lost or what you don't have. So I know that this has taken a whole lot of time, and I want to thank everybody. And I don't know if we have questions, but I would love to answer any questions that we have. I don't know if you guys can hear me, but I can't hear you.
I wasn't sure if you could hear this.
Now I can.
I just wanted to thank you so much for your presentation and let the participants know that many of the questions that were sent to us were answered in your presentation.
Okay.
To let them know to please keep in mind that not all questions submitted will be asked due to the clinical nature of some of them. And if you've submitted a question and did not hear it, please feel free to call the SHARE helpline. The trained survivor will get you more information. So very quickly, a little over time here, but 3 very important questions
Great.
were The first one is, what are the best ways for couples to approach talking about sexuality?
Wow, that's a very broad question. And I think the most important thing is, maybe talk about what you learned here. Say, hey, you know what? I have been reading that sex and sexual activity is actually really good for my health and in all dimensions of my health. And that might be one way of opening up the conversation.
Thank you. The second question is, what can be done to improve my sex drive? What can be done to get my libido back, even while I'm on tamoxifen?
So libido seems to really have it's a multidimensional process. It has to do somewhat with hormones, but it also has to do with how you feel about yourself, emotionally how you think about sex. It's going to be very tough when you have estrogen being suppressed on something like tamoxifen. And we know that that estrogen is probably the biggest player in the brain when it comes to libido, and it works in combination with estrogen. Exercise is probably the best way. Keeping levels of inflammation low, so staying away from things like sugar and carbs, which tend to boost insulin, and that tends to create more inflammation in our bodies. Stay away from those things and have just a healthy, clean lifestyle. But exercise, and then the other thing too, which I do discuss in my book, is if you allow yourself 3 minutes a day to think about something that you really enjoy about sex, I think that's a really wonderful exercise, because the more you think about sex in a positive way, the more you think about sex in a positive way. And that's true in the opposite direction too. So allow yourself more positive thoughts about sex. You're welcome.
So the last question we have is, my husband had a hard time dealing with my mastectomy. How can I expect a new person in my life to accept it?
Well, I think that when someone really loves you, or let's not bring love into it, because we're just talking about sex right now, which may or may not, I think sexiness really goes just beyond breast. And this is what I was talking about, body image. And if someone else has defined what they find attractive in you as just breasts, then they've missed this whole other aspect. I mean, all the multidimensional aspects of who you are as a sexual person. And all of those things continue to exist, even if you've had a mastectomy, even if you've had a reconstruction, even if you've had a lumpectomy and one is bigger than the other. Like, those things, that is a very narrow definition of what creates femininity and sexiness and sexuality. So find those things in you that have to do with your sexuality that don't have to do with your breasts, and then other people, new people, will see that in you as well.
Thank you. Well, I'd like to thank you once again, Dr. Castellanos, for an informative program, and thanks to all of you for participating. Please take a moment to fill out the survey at the end of the webinar. It may take a minute for the survey to download. And once again, Dr. Castellanos, very interesting.
My pleasure, Iris. Thank you.